Okay, guys, here it is. Last one, lesson 5. We're going to do aplastic anemia first. Aplastic anemia can be very dangerous. It's when there's suppression of the red bone marrow. And what happens is when you suppress red bone marrow, you don't have enough production of red blood cells and white blood cells. Now, most of the time, aplastic anemia is idiopathic, meaning they don't know what causes it. And that's basically just a fancy word for we don't know what causes it. It can be acquired through illness, through drugs, exposure to radiation or chemo. It can be inherited. It could be related to autoimmune. I had a good friend that I worked with who did anesthesia. His wife came in. She was diagnosed with aplastic anemia. They believed it was from the heart drugs that she was taking. And of course, they stopped the drugs, but she wasn't getting better. And they actually thought they were going to lose her. And then all of a sudden, her body just kicked in and started making all of these red blood cells and white blood cells. But it was very scary for her husband. And we were friends with her. So it was scary for all of us, too. So if you remove the toxic substance or you discontinue the drugs, discontinue radiation, your body should come back, but sometimes it doesn't, and it can be fatal. Polycythemia is different. So polycythemia is increased red blood cells. And this can happen temporarily when you have altitudes that have less oxygen. So people that live on top of the Rockies have a lot more red blood cells than us because there's a lot less oxygen. So your body compensates by making more red blood cells so that you can get whatever oxygen there is. A lot of times, athletes will train in the high altitudes because if they have all of these extra red blood cells, then they're going to have a lot more oxygen circulating in their bodies when they compete. For instance, in the cyclists in Europe often train in the Alps. Another version, polycythemia vera, and this has unknown causes. They don't know what causes it. So it causes coagulation. We don't want that because then you have clots and then you can have pulmonary embolism. And what they do is they give them phlebotomy and also low-dose aspirin medications to suppress the red bone marrow. You don't want to have too many red blood cells. So if it's a disorder of polycythemia and not related to altitude, then they have to suppress that bone marrow. The low-dose aspirin is an anticoagulant. It thins your blood, so that helps as well. Another one that we've talked about in class already is an embolism. So an embolus that travels through an artery too small for passage can block that artery. That is a really, really bad thing. You do not want to block arteries because they are what brings oxygenated blood to wherever that particular artery is feeding. So it could be a clot, and there's different embolisms. There can be clots of blood. It can be an air embolus, cancer cells, fat embolus. I treated a 19-year-old who broke his femur and he ended up with a fat embolus. It can be bacterial clumps from septicemia. It can be a needle. Sometimes drug addicts will use old needles and the needle will break off the tip. And the same thing with fibers. It can be, fiber. As I said before, open fractures can release a fat embolism. There's also amniotic embolisms, and that usually happens post-birth because what happens is when the placenta is delivered, you immediately open up an artery, and if there's amniotic fluid gets into that artery, now you have an amniotic embolism. Very, very dangerous for the mother. Next, we have thrombosis. Thrombosis is the formation of a blood clot. So we talked about deep vein thrombosis, and that's when you have, like in the big veins of your legs, you'll get a clot. And that clot it can be pretty big. Remember when we had the guest that showed us what he does in the lab or in the interventional radiology, he talked about a deep vein thrombosis that was huge that they pulled out. So it can cut off circulation, slow circulation. Um, Pieces can break off from a DVT and go to your brain, can go to your lungs. It can be very, very dangerous. And basically, it's just a big formation of a blood clot. People who sit on planes or in traveling and don't stop and move their legs around can develop thrombosis. Thrombocytopenia, that's decreased platelets. We all know that you need platelets for clotting. So if you don't have enough, you're not going to clot properly. Because remember, right, those platelets, they go over that rough area and they start the whole clotting process. If you don't have enough, you don't have a clot, you're just going to bleed. Leukemia. So leukemia is a malignant cancer. And what it is an increase in white blood cells. So you're supposed to have a regular red count of white blood cells and a regular count of red blood cells. Red blood cells carry oxygen. So what happens when you have leukemia, you are having an overabundant immature white blood cells replacing your red blood cells. So there's something that has gone very, very wrong. Because of this immature white blood cells, they stimulate immature red blood cells. You develop anemia, fever, sweats, headache, swollen lymph nodes, bruising. It can be fatal, as the more acute forms are actually found in children, and they can be fatal. Chronic is usually an adult and more asymptomatic. My mom was diagnosed with leukemia a couple of years ago. It's chronic. It's because she's in her 80s, but she's doing fine. And it's classified as either myelogenous, which is a problem in the bone marrow, or lymphocytic, which is the lymph nodes. It's the white blood cells that are produced in the lymph nodes. They don't know what causes it. Usually they have to treat this with chemo, drug therapy, bone marrow transplants, radiation. It's cancer. And then we have multiple myeloma. This one is just so bad. It's a cancer of plasma cells or B lymphocytes, and it causes weakened bones, pathologic fractures, and bone pain. It's just so awful to watch. There's a decrease in blood components, and multiple myeloma. The prognosis for this is very, very poor. This is something that, to have a patient come in and get diagnosed with this is just really devastating. They try to treat it, but chemo and radiation are not very effective. Multiple myeloma is just a very, very dangerous disease. I've taken care of more than one patient. One was a 26-year-old who was visiting our country, and she banged her upper arm against the door frame, just a bump, and broke her arm. I had another lady who she was on an airplane and she was uncrossing her legs and broke her ankle, and that's how she found out she had it. And then finally, septicemia. You guys, we've talked about septicemia, and this is when pathogenic organisms or toxins get into the blood. So this is bacterial infection. Okay. What happens is the bacteria are in your skin or maybe a cellulose, and all of a sudden they go deep enough to get into your vascular system. It gets into your vascular system, and now you have these bacterial infection through your whole body, and that's septicemia. They treat you with antibiotics and any therapy that you need to support an organ dysfunction. So, for instance, if your kidneys are in trouble, they'll use dialysis to help you with your kidney function because of the bacterial infection. Bacterial infections can take over so fast. You should never ignore an infection. Septicemia can be fatal, and it depends on how long you've waited. But basically, that's it in a nutshell. All right, so we are done, and I will see you guys in class, and we'll go over some of these in class. I'll see you later.